think that a single payer system would eliminate the overhead, the cost of insurance companies, but also pharmaceutical companies. I read an article the other day that said that hospitals that restrict representatives from pharmaceutical companies from making, having access into the hospitals and promoting their drugs, that physicians are more likely to recommend generic drugs versus those that are being touted by reps that come in and give them gifts and do all that kind of stuff. That would go away, right?
That very much would go away. And our co-founders, Dr. David Himmelstein and Steffi Woolhandler, did some additional research that showed that if we simply could negotiate drug prices, we could save an additional $100 billion or so a year in drug prices.
The other thing, one more thing that I thought was fascinating, and I think this is correct. I think it came from one of Michael Moore's movies or whatever, I'm not sure. But I think we're either the only country or maybe one of two countries in the world that allow pharmaceutical companies to advertise on television.
I actually have practiced in the only two countries in the world that allow that, the United States of America and New Zealand.
New Zealand.
When I closed my practice in 2012 in Maryland, I moved to New Zealand for a year because I wanted to work in a country that actually has a national health program, so that when I came back to the United States and continued to advocate for Medicare for all, I could say I've actually worked in a country that has this. And guess what? It isn't perfect. It's just a whole lot better than what we are doing. And I believe that the American people, being the resourceful people, the intelligent people that we are, we could make the world's absolutely best and most conservatively funded, liberally delivered healthcare system in the world. We have eliminated all the other possibilities, and I know my congressman is a fiscal conservative, and I want him as a co-sponsor of HR 676, because as he said to me, Carol, I don't want this bill just to pass. I want it to succeed. And it's going to succeed by having fiscally conservative people making damn sure it does succeed. When Congressman Cooper agreed to sign on, he said, you can feel excited about this, but don't feel excited for very long because you've still got a whole lot of work to do. And I said, tell me specifically what you think we need to focus on. He said, you need to get business signed on in support of this, and you need bipartisan support. You need Republicans. And so I took that very seriously. And we now have an entity, a campaign called Business Leaders Transforming Healthcare. It's run, at the helm of it is a man named Richard Master, who wrote and directed the movie Fix It, the documentary Fix It.
Oh.
Healthcare at the Tipping Point. I highly recommend it. You can see it on YouTube for free or on their website.
Called Fix It?
Fix It.
Okay.
Healthcare at the Tipping Point. He is a businessman. He owns a mirror and frame manufacturing company in Pennsylvania. And he said, absolutely, the fact that I have to negotiate health insurance year after year after year is cutting into my ability to grow my business and to give my employees raises and to increase the number of people I can hire.
It's crazy.
The National Health Program is a job creator. So
what do we need to do? What do we need to do to go make this happen?
We need to gain the support of the business community, and we also need to gain the support of conservative members of our society who are going to be just as much hurt, if not more hurt, by the American Health Care Act, if it actually goes through, than other people. We need to help them see that this is not a partisan issue, that healthcare is a social good for all Americans. And as I said at the beginning, I want good healthcare for everyone in America. Everyone, including people who on other issues may not agree with me on, liberal, conservative.
So would it be fair? Would it be fair to say that you want health care for everyone in the same way that we want education for our children up to high school, and a program that's put into place that makes it available that people can get those services without having to pay extraordinary fees and costs and all that? I mean, isn't it the same?
Pick your issue, whether it's education or police. I mean, I was burglarized a few years ago. And when the police came to my house, they didn't ask whether I had police insurance or not to decide whether or not they were going to investigate the crime or help me. If I had a fire at my house, I don't think the fire department is going to come and say, well, you didn't pay your fire insurance last month, so we're just going to stand here and let your house burn down. So there are some things that are just a social good that really don't lend themselves to commodification. And I would say that healthcare is one of those. And it's just time. We really are ready. I think the American people are ready. And frankly, the last time the Republicans tried to pass this piece of legislation a month ago, we saw an increase in co-sponsors of H.R. 676 to the tune of 24. So now that they have passed their AHCA and are sending it on to the Senate, I full well expect to see many more co-sponsors of H.R. 676, because these members of Congress are going to go home in the next week and they are going to get an earful from their constituents. So I actually won't be surprised if we have our first Republican co-sponsor in the next couple of weeks.